Today I'm talking to Dr. Gordon MacDonald, who's a GP in Glasgow. Gordon, tell me a little bit about this concept of the far end.
With the far end practice concept, I'm trying to suggest that practices with significant numbers of elderly folks, really at the far end of their life, have an equally challenging situation as the deep end practices. And maybe we could say that they've got the same level of multimorbidity, but they've actually got associated frailty, sensory losses, and some of them have got reduced social capacity and maybe declining cognition as well. So I think there's a need to look at this particular group in some depth. That was really where I was coming from.
With the changes in general practice, how have the far end patients managed?
That's a good question. I think they have struggled in many ways. I'm sure, like many practices, we have a really high home visiting rate, but we've seen that fall by about 90%. And that particularly affects these far end patients. They're more isolated as well. They're less likely to access care from their general practitioner. They're more stoical. We know that anecdotally, but I think we've seen that play out again in that they really don't want to bother the GP for a home visit. And I think the most striking observation for me has been the fact that they have probably been less able to access remote consultations. You know, we've seen, like many, the rollout of lots of great things like WhatsApp or Attend Anywhere to access and see our patients, but our very elderly patients are just not quite so savvy with that. They're not quite so able. So I think they've probably been disadvantaged and actually maybe even pushed further to the far end, as it were.
When the COVID crisis eases, how do you feel our far end patients are going to cope? How are we going to catch up with their needs?
I think there's going to be a need for them to understand that it's time now to come back, that there is permission to come back, to see their GP and to re-engage with their long-term chronic conditions. I think that may require some advertising both centrally and specifically locally from practices, communicating and publicising that. And it may be that we specifically look at that far end population, starting with the over 85s, the over 80s, and contacting them proactively, or asking some of our ANPs to get involved in that and coordinate a Teams approach so that we can link in with them again and identify those at highest need. Maybe looking at the shielding patients who are at the far end first as well would be another option.
How would we redesign general practice to best meet the needs of our far end patients?
I've been thinking a little bit about that, and I wonder if there are some of the new IT options that we could harness. For example, maybe we could actually begin to link with telehealth providers and social care providers to create some remote access to consultations that works, that's logistically and ergonomically functional for our older folks that they can actually use. Or maybe something else that we're trying to pilot would be using our new team of volunteers to take the iPad out to the patient in their home and actually access them remotely once the volunteers set that up for them. And then another idea that we've had is remote access into secondary care. So for example, we're piloting a project with our local psychogeriatric allocations meeting. So I'll be remotely involved in the Microsoft Teams meeting, hopefully facilitating their care that way, so that there's a streamlining of service and reducing delays in our patients accessing care. So I hope that some of the new IT will actually help as well.